started my path professionally a number of years ago as a hospital administrator of all things, working particularly in the area of business development, marketing. I used to promote oncology programs and all kinds of wonderful things. Come to our hospital and we could fix anything. The reality is that now what I've learned through this experience I'll describe, I'm not sure we could fix anything. And I regret, in some cases, some of the commercials we put out there and the promises we made that we could never fulfill. And that's really the case and the challenge that all of us have. We're all talking about a lot of things here, patient-centered. This conversation is all going to be about patient-centered care. But my journey began in earnest when my wife was diagnosed with stage 4 lung cancer. And this was in San Jose, California, which is where I'm located, in the heart of Silicon Valley, lots of good medical facilities. And we obviously were traumatized when we heard the news on 5 o'clock on a Friday afternoon in my wife's primary care physician's office. And that began this journey through the healthcare system. And as providers, my wife was a nurse, is a nurse. I'm a hospital administrator. We thought we understood the system. And as I got into the process, and as we both got into the process and started learning about, or attempting to learn about how to find the right specialists, how to get second opinions and whatnot, we had some very untoward experiences, very discouraging experiences. And to make a long story short, after my wife was locally deemed to be non-salvageable, through the local tumor board in the local hospital, she and I ended up finding our way to MD Anderson. And this isn't a commercial for MD Anderson. It's a commercial about the challenge of navigating as a patient through the system and how communications is part of this. Well, we ended up in Texas. She ended up with some very good medical oncologists and radiation oncologists. The radiation oncologist came out and squeezed her cheek, and he says, "I think we can cure you." And 7 years later, my wife is now cancer-free, stage 4 lung cancer, 5% survival rate. And the difference is finding the right people and having the right conversations and getting the right care. And unfortunately, as we're going to talk about today, that doesn't happen as often as it should.